Aloha, welcome to HHIE's training session. Today we'll be taking a quick tour of the Hawaii Health Information Exchange's Community Health Record, also known as the CHR. The CHR is one of Hawaii's most powerful healthcare tools. It brings together clinical data from hospitals, clinics, specialty providers, labs, pharmacies, and health plans across our islands, giving care teams real-time healthcare data that they can use to reduce duplication, streamline workflows, and ultimately improve patient outcomes. Today, we'll explore how to quickly find the information you need, including reviewing medical record reports like specialist progress notes, ER provider notes, and inpatient discharge summaries using the Results and Documents tab. We will explore how to access laboratory studies and view radiology reports, as well as run a medication query. Let's get started and see how the CHR can help you deliver better care for Hawaii's people. So to start, you see on my screen that I have the data matrix. So we just updated this in September to include our newest data sharing partners. And the left-hand side indicates the facilities that share clinical data with us. And the columns indicate the type of data that is being shared. If it is in blue, it is a data source that we do have. And you can see the areas in white are either data gaps, ones we are working to fill, or they are a service that that particular participating facility does not have available to share. The legend at the bottom of the screen really helps to determine whether that clinical data that is provided is in the Results tab, which will make sense as we get into this training, or if the data is in the Documents tab. So for our facilities like Queens, Castle, HHSC East, HHSC West, and the Cancer Center of Hawaii, our clinical labs, diagnostic lab partners, Hawaii Diagnostic Radiology, as well as our over 200 private practices using Elation EHR, that clinical data is going to be found in the Results tab. However, we have a lot of other data sources, and they share their data in a different format, which means that we have to go through the Documents tab. The Documents tab is where you find clinical data related to Hawaii Pacific Health, the VA and DoD, Kaiser Permanente, as well as Maui Health Systems. This is where you find Kahuku Medical Center data, HHSC Kauai, as well as Molokai Community Health Center and Rehab Hospital of the Pacific. This is a really great resource if you are trying to identify whether that clinical data is in the community health record, as well as where that you can find that clinical data until you become more familiar with the platform. This is available on our website, and you can also reach out to us and we can send it to you via email if you would like that to have that. The second source is going to be the tip sheet. This is also located on our website. This is a really great resource for first-time users. It goes step-by-step through the Community Health Record portal, and it also gives you some helpful tips to help guide your search, as well as some areas here at the bottom, like you see the Results tab, what clinical data is found there versus what clinical data is found in the Documents tab. So both of these are really great resources to have available if you are a first-time user until you get familiar with the Community Health Record portal itself. Here's our homepage, hawaiihie.org. You can access the information that I just covered, including the tip sheet and the data matrix here. You can also access our community forum if you would like to join on the second Wednesday of every month to join that. We go over different topics each month, so very excited to bring that back. And here you can actually access the Community Health Record. If you go up here on the right-hand side to the Health eNet, and you click that link, it will then bring you over to the portal. That is one of the ways you can access it. As always, you can just use the URL here. It is available on the tip sheet as well to help just favorite this as a source of login. You do not have to go through the homepage to access the portal. So while you're here, each user has their own unique user ID. So meaning you can't share user IDs with other people. Your user ID is unique to you, and you are given a default password for your initial login. Once you complete the initial login, so you'll use that username we provide you as well as a password. They are both case sensitive and do have to be lowercase. You are going to log in. It will have you accept the end user licensing agreement. You will set up your 3 security questions, which can be used in the event that you forget your password so that you can reset it. And then you will change the password to one you prefer. Once you do that initial login, you can then come in and log in with your new credentials, and then you can log in that way. If you ever forget your password once you've done your initial login, the reset password option is available here, and it will allow you to answer those security questions, and then you can change your password. If you get locked out or you can't remember your user ID or your username or your password, if you get locked out, you can access here the help desk at hawaiihie.org, or give us a call and we can help get your account unlocked. So today I'm going to be logging in. And we're going to be doing a test patient search. Once you complete the login, we're going to come in and we are going to do a patient search using the search text bar. This search text bar is a or option. You can either enter in the patient's name, and you can do last name, comma, first name, or first and last. You can enter in the medical record number or social security number. However, those are very limited. MRNs change on facility, and social security numbers are not always provided by the patient. So if you do use those as search options, you may limit the type of data that you see in the community health record portal. I do recommend searching either name or date of birth. For those patients that may have really common names, I see a lot of use with this for okinas or hyphens in names. You may want to use the advanced search option. This is an and option. So here you can enter in the patient's name and date of birth to really narrow your focus to the patient you're asking to view. So today we're going to be doing a search using a test patient. You can see I'm doing last name, comma, first name, and we're going to hit search. Now, because this is a test patient, it may look a little different. Right now, it shows that there's a patient here because this is a test patient. However, if this was a real patient, most of the time it's going to show you and say no records to display. And you can see at the top that we have a little plus sign that indicates that when you are trying to access patient records, you're taking responsibility that you are only accessing this for a reason, right? You have a reason for accessing the patient records. So what you have to do, and everybody's view looks a little different. Currently, mine is set up to be like a staff with like a clinic or a practice. You may or may not have 2 of the little boxes here like I do. You may just have 1, and that's totally fine. So the way that we do this and why, for the most part, you search and you will see that it says no records available. You have to fill both of these in first before you can see patient records, because you're marking here that you have the appropriate reason for viewing. So we select our provider if you have that box, and then you select your reason. And some practices, like I said, they only have select your reason. They don't have a provider dropdown. So when you select your reason, you can see that there's a lot of different options. This one should come internally to your practice. If you feel that, whatever that reason, if you are a practice, a clinic, and you say, we have established clinical relations, maybe you've been requested as a consultation if you are a specialty provider, they're new to your practice, whatever that reason that best fits your circumstances for accessing the patient records, you definitely want to choose that option. Just know that whatever option you choose, it does not change the clinical data you see in the community health record portal. So I'm going to select my reason, and I'm going to hit access additional records. So for the most part, if this was a real patient, primarily it would say no records to display. And then once I select the reason and my provider and I hit access additional records, now it will bring in the clinical records for me to see. So after doing my search, you can see that I have 2 different instances of my patient. And always, it could be two separate patients, right? We could have the same patient with the same first and last name, as well as the same date of birth. That is definitely something that would be in the wheelhouse as something that could happen. But a lot of times we may see that we have two different records for the same patient. And that is why HHIE is unique in that we are a data repository that allows you as a user to come in and search for your patient records. Whereas an EHR, if that clinical data from one facility doesn't match the name for another facility, you won't be able to access those records in an interoperable EHR because it does not match. So therefore, it will not be pulled into that patient's chart. However, because HHIE has data connections across the islands, we will still display that data, but we're just not going to merge that clinical data together into one record. We're going to allow you to view it as a separate record. So you can access multiple different records, no matter how that name or how that demographic is displayed. So you can see here on this primary patient that is at the top, there's a plus sign next to the name. When I click open the plus sign, I see that not only was there clinical lab data available, but I also have data from the Queens Medical Center. So that means that the data from, or the demographics from clinical labs as well as Queens was able to meet HHIE's standard of 95% or greater match. And so we were able to merge that data together to form one unique record. For some reason, when this patient went to Dr. Madamba's office, the demographics did not meet that 95% or greater match. Therefore, that clinical data was left on its own. You can definitely click into this. If you want to, I see if this is the same patient that you're looking for, and you want to go in and view the records, by all means, you can click into that individual record, but you're only going to see data related to Dr. Madamba, whereas in this one, you're going to see data related to clinical labs and Queens Medical Center. So I'm going to click into this primary chart here, and we're going to begin our search through the Community Health Record Portal. The first thing that populates when you open the Community Health Record Portal into the patient is the patient summary field. Today's training is going to highlight the commonly used areas. However, there are some additional areas to explore. One of those areas that I highly recommend that users do not use in their daily navigation is going to be the patient summary field. Here you see some tabs located below, and some users will use this without realizing that they're really only getting a snippet of the patient's healthcare data. This is only going to populate with most recent. It's not going to populate with complete clinical data. For instance, even though this is a test patient, the ambulatory medications here are only going to populate with whatever ambulatory medications the patient has had queried. So if they've never had a medication query completed, or if they have never had, or if someone queried the medications way back in 2019 and no one's ever been here to query them again, the medications are going to show here from that query in 2019, not from the query we're going to run today. So we're not going to use this field to search through the patient chart. Today, we are going to focus on the dark gray bar over here on the left-hand side, and we're going to focus on the results tab, the medication tab, and the documents tab. So we're first going to navigate to the results tab. The results tab is where we find clinical data, and again, referencing back to our data sharing partner matrix, that is where you find the clinical data that has no asterisks after their name. So that's going to be clinical labs, diagnostic labs, Hawaii Diagnostic Radiology, the Queens Health System, Castle Medical Center, as well as our Elation EHR partners. If they do use Elation EHR and they're a private practice that shares clinical data, their reports are going to be here as well. This is also where you find the Cancer Center of Hawaii clinical data, as well as HHSC East and HHSC West. So given that this is a test patient, the data is a little limited in what we're able to see. However, I can demonstrate the capabilities and some helpful tips to help navigate. So for this patient, we see that we have available labs, radiology, transcription reports, as well as pathology notes. Some patients may have the availability of another checkbox that would indicate CARD, which is cardiology, and it would include things like EKGs and echocardiograms. While using this section, I can use my search text feature to quickly find data that I may want to view. If you are looking at all of these with the check boxes and you say, I really am just looking to see if my patient has had their CBC, when their CBC was completed, I can come in here and type in the word CBC, and now it'll directly search for that CBC encounter. I can click open the CBC, and now I am ready to view that CBC result. What it is also going to do is it's going to allow the records to pull in together to include any additional labs that were ordered at the same time. So if a patient, for instance, went to their primary care provider for their annual checkup and the doctor ordered all of their labs, including the CBC, CMP, TSH, A1C, maybe they ordered a lipid panel, all of that information, because they were ordered at the same visit, will all be pulled together. So you're able to see that all in one source. The Community Health Record Portal does have the availability to print. So if you hit the print option, you are able to export that lab result into a PDF version. You can hit the print option and now save as a PDF, which will allow you to export this into a PDF document you can upload to your EHR. So that is one of the many ways to use this section. You can also deselect all, and now you can navigate directly to the type of data you're looking for. So let's say I'm looking for a medical record report, which is going to be included in the trans. I know my patient went to the Queens Medical Center, and I know that the clinical data for the Queens Medical Center is going to be housed in the results tab, and it can be found under the trans location. Here is the discharge summary example of how that clinical data is displayed. I find the clinical data that I would like to see. I click into there, and now I have a little hyperlink to view. This is unique to the Cancer Center of Hawaii, Queens Medical Center, as well as Kona Community Hospital. They share their clinical documentation as a little PDF link. We click that link, it will download my report, and now I have it available for viewing. Obviously, this is a test patient, so the data is going to be really short. However, the clinical documentation is going to include the entire discharge summary. If you find that this is a report that you will need to provide as a download, and maybe you want to include it in your EHR, you do have the availability of the print option as well. If I return to results, it's going to bring me back to my original search, and I can continue on navigating. That is how the clinical data is displayed from Queens, the Cancer Center of Hawaii, as well as Kona Community Hospital. However, some of our facilities, like Hilo Medical Center and Castle Medical Center, they share their clinical documentation as a free text, meaning if I'm going to show you what a radiology report looks like. So if I find a radiology report that I am interested in viewing, I click open the report and it will display. This is how you will see that Castle Medical Center as well as Hilo clinical data as well. It will just display for you to view. And then you do have that print option as well here. For our radiology reports, this is going to be from the radiology fields that are coming from those same facilities that share their transcription reports. They are coming there, as well as our Hawaii Diagnostic Radiology Services. That is our newest addition. So you can view the report. It is not a PACS system. There is no image viewer here. It will just give you the report so that you can view that. The results tab is very user-friendly. It's very easy to navigate through. I showed you two of the key ways. Another way you can do this is by sorting it. These are all sortable tabs as well. So if you want to sort by facility, maybe you want to sort by provider, these are all easy ways to sort and find the data very quickly. It defaults to sorting it by order. So this is going to be the most recent, and then it's going to go backwards in time from there. The next section, we're going to skip medications just for a moment and go straight to the Documents tab. Over the past year, I've been doing a lot of refresher trainings for users who've been using our system for 5 to 10 years, and they often forget that this exists, or they were never trained on it because originally the data sources were not here. But now that we have clinical data expanded, the Documents tab houses a lot of great clinical data available, but it's often overlooked. So the Documents tab is where you find clinical data from those with an asterisk after their name. Again, just kind of reiterating those. That's going to be the DOD, HHSC Kauai, VA, Hawaii Pacific Health, Kahuku Medical Center, Molokai Community Health Center, Rehab Hospital of Pacific, as well as Kaiser Permanente and Maui Health Systems. The reason I think it often gets overlooked is that when you first come in, unless it is a facility like Rehab Hospital of Pacific, that clinical data does not exist unless you find those documents. So Rehab Hospital of Pacific, if you are looking for them, when you come to the Documents tab, it will just automatically display for you. However, for our other care partners that share, we actually have to do a query and retrieve. And so because this is a test patient, unfortunately, I'm not going to be able to show you real time what that looks like, but I do have screenshots to allow you to see how that query works. Just going to make this a little bit bigger. Here we go. So you come to the Documents tab and you select Find External Documents. Once it completes the search, you're going to put a checkbox here indicating that yes, this is your patient, and you will hit Find Patient Documents. We're going to follow the blue buttons. Once that query has been completed, it's going to return and provide you all of these additional documents. So it's saying that it had found data from Hawaii Pacific Health as well as Kaiser Permanente. And I'm going to load those selected documents. Now, instead of no records to display, I have these clinical documentation to review from this facility. Now, this is going to pull in from Hawaii Pacific Health, the Kaiser Permanente, VA, DOD, as well as HHSC Kauai and Kahuku Medical Center. So when you pull in that clinical data, whereas the Results tab, there is an easy way to navigate this. The Documents tab can be a little different, and so that's why I'm here to provide you with some helpful tips for navigating this section. So you can see just based off of this is a shorter list, but all of that clinical documentation is kind of sorted by facility. All of the HPHs are together, and then you have the Kaiser document at the bottom. And this is how we would do it. Even if you have a patient who has been seen at HPH, Kaiser, and the VA and DOD, all of those are going to be sorted by facility. And they do have different ways of displaying that data. For the most part, Hawaii Pacific Health and Kaiser Permanente do have similar displaying criteria. So what we are going to do is we're going to go through and view. So this top level document is a continuity of care document from HPH. This document is present on every single chart anytime you pull in records from those facilities, and it's going to be a high-level care document that's going to highlight their overall experience with HPH, and it's going to be very high-level focused. Think encounters, it's going to be insurance information, contact information. It's not really going to get into visit-specific data. Once I go down from that list, now I see this second item here is going to be the most recent encounter the patient has had with that facility. And I can see that it's labeled as an office visit. When I think of office visits and I see that here, I think of primary care. I think of specialist notes, maybe PT, OT, or speech. This is going to be some type of outpatient visit. And I know that this is the most recent. So that's the way that these are displayed. This is going to be the most recent, and then it's going to go backwards in time from there. Some of the other descriptors that you may see is going to be things like this, where it says orders only. Again, this is pretty self-explanatory. This encounter is going to only include orders. Telephone. This one could indicate the patient has been called for lab results, or maybe the patient called in requesting an appointment or requesting lab results or requesting a refill. It is some type of telephone encounter. This is not to be confused with a term telemedicine. So if you see telemedicine CCD, then that indicates that the patient has been seen for some type of telehealth appointment. The emergency CCDs indicates an emergency room visit. And then hospital encounter CCDs are going to be things like discharge summaries. If the patient has been in the hospital and they've been discharged, then once they are discharged, you will see a hospital encounter CCD, which includes their discharge summary. This can also be outpatient procedures like CT scans, MRIs, mammograms. If the patient has gone to the hospital for some type of radiologic procedure, then that is also going to be labeled as a hospital encounter as well. So you can use those specific naming conventions. If you know the patient was just discharged from HPH, obviously you're going to see the hospital encounter, and it's going to be up here at the top, right? Because it just took place. And the same thing takes place for Kaiser. Kaisers are going to be displayed exactly the same way. Unfortunately, I don't have an example of what the others look like, but the VA is going to say outpatient progress note for every single one of theirs, and they are in reverse order, meaning that the older notes are at the top and the newer notes are at the bottom. And for the DOD, so if you've got someone who's active duty or prior military and they have a DOD record, that is actually going to be one single record. It's going to say DOD/VA. However, the VA is a separate notes individually, but for their DOD record, it's going to say DOD/VA, and it's going to include all of their DOD history. And that's across all military treatment facilities. It's not specific to just Tripler. I do have examples of what those look like. So if you were to click into one of them, there's an example of the HPH one. You can see the table of contents of what exactly is included. Here's an example of the Kaiser. They look very, very similar. You can see what that looks like. Obviously, protecting PHI, I wasn't able to include everything, but you can definitely see how that looks. And it's going to display with everything related to that visit, including HPI, review of systems, chief complaint, assessment and plans, physical exam, appointments, things like that. All of that information is going to be in those documents. If you find that you open up a document, whether it's a emergency CCD or maybe it's a hospital encounter office visit, if you open one and you do need to export, that print option is available as well, so that you can export those documents into your EHR. So like I said, this area is often overlooked, but it really pulls in great additional clinical data. It's really just about being able to pull through those records in an effective way. So hopefully I've demonstrated that. You can always feel free to reach out to us for one-on-one training or for some additional workflow guidance. So that's the Documents tab. Next is going to be the Medication tab. The Medication tab is one of our most used items in the Community Health Record Portal because the medication query. So the medication query can be ran once every 24 hours per patient. And you can see this is a test patient. There's nothing to display, but you can see that the last query ran was on 4/24/25. And if there was medications displayed here, that is what medications would be showing me, would be the medications that were done when that query was last ran. And so what I can do is if I come into the medication query and I want to query my patient's medications, I can come in, hit this blue button, and I do have it in a displayable way to show you how this works. So you click the blue button for the medication query to run. Unlike the Documents tab where we do have to sit and wait on it, the medication query will run in the background for you. So you can be doing other things. You can navigate to the Results tab and be looking at your patient's discharge summary, or you can be in the Documents tab pulling in those records. You do not have to sit and wait for this to run. but it is looking at ambulatory pharmacies, and it is a very robust data feed system. A lot of EHRs now do have the ability to query to identify medications. However, our medication query is a very comprehensive and widespread query. I have seen mail order populate here. I have seen small pharmacies. I've also seen large pharmacies, Long's, Walgreens, 5 Minute Pharmacy, KTA Pharmacy, the VA, Queens Punch Bowl Pharmacy. I have seen a lot of different pharmacies populate in this area. Once that medication query is complete, it will populate at the top, indicating that the medication query is done. So then even if you're in the results tab, you can come right back and view it. So now it'll be grayed out. And the reason it's grayed out is because you've already ran that query today. So that means if you work in a team and someone's already come in and queried that medication history for the day, they've basically just done the job for you because you see that it was already ran and the medications will be displayed. So basically you just get to have access to it without having to sit and wait for the query to run. So when you first open it up, you see that you've got medication and strength. We get the pharmacy, the prescriber, and the date it was last filled. If I open up the plus sign at the top, I get additional details, including the quantity that was prescribed, as well as the day supply. Again, just like with the other tabs, these are all sortable features, so I am able to sort them if you want to put them in alphabetical order, or maybe you want to sort them by pharmacy or prescriber. Use case for alphabetical order, I love doing that when I'm trying to identify narcotic use. So if the patient's on a narcotic and I'm trying to track, how often they're getting that medication filled, you can do it that way. One of the questions I get frequently asked is whether or not this indicates the patient has actively picked up that medication. And it really depends on the pharmacy's practices. Best practice for pharmacy is that they do not scan that medication until the patient presents to the pharmacy to pick it up. However, that doesn't always happen. Sometimes practices include scanning the medication so that way when the patient's there to pick it up, they just automatically hand it to the patient. So I can't guarantee that the patient has picked up this medication, depending on what the pharmacy's practices are. But hopefully, if pharmacies are following best practices, then yes, the only way they would populate here would be if the patient picked up that medication. The medication reconciliation form can actually be printed. I don't have an example of it, but I personally love to view it. So once you run your query, hit the print option and see what that looks like and see if it's going to be helpful to your workflow. The reason I like what it looks like is it's a fillable MAR. So meaning if you are someone who has to coordinate with the patient, are you still taking this medication? If you have that exportable MAR, you can basically be filling in it while you ask questions because it has free text areas. Like you can fill in, how do you take that medication? Is it twice a day, once a day? Do you take 1 tablet, 2 tablets? And then at the other side, it says, what is the last date and time of your last dose? You can also at the bottom, it does have free text area where you can insert over the counters and herbals as well. So it really allows you to coordinate with the patient to fill in that to determine whether or not they're still taking those medications. I love the medication query. It's been such a help and such an important piece of it. I've instructed so many of my users who have really great EHRs to compare, because from what I've heard from our users is that this medication query can really pull in additional resources and identify so many areas where the patient EHR medication is not populating with the most up-to-date. The last section that I want to go over. So again, just reiterating what we've highlighted today, the results tab. This is clinical documentation that you find from our clinical lab partners, Diagnostic Labs, Hawaii Diagnostic Radiology, Queens, Castle, HHSC East, HHSC West, as well as our Elation EHR partners and our the Cancer Center of Hawaii partners as well. Great resource, great, easy to sort, navigate through. The medication tab is where you can run a medication query once every 24 hours per patient to identify most up-to-date medication records. And then the documents tab is a query and retrieve function to pull in that clinical documentation from facilities like HPH, Kaiser, Maui Health Systems, the VA, the DoD, Kahuku Medical Center, Molokai Community Health Center, and Rehab Hospital Pacific. So if you are coming in, these 3 tabs are going to be the most useful tabs in your workflow. The profile and face sheet section over here on the right-hand side is an additional resource for identifying key information related to your patient's demographics and kind of their history of where they've been. So the first tab is the demographics tab, which you can definitely sort by facility and see clinical information such as contact information and insurance information as well. I personally like face sheets a lot better. The face sheet section is visit specific. So you can see here, I'm looking at the most recent visit. So that will always be at the top. And I can basically track my patient's history. So I kind of know where they are. And just kind of looking at the data matrix, this is going to be areas that populate with blue in this admission, discharge, and transfer column. So if they share those ADTs with us, then that is going to populate a face sheet in this section. So you can see visit specific. I'm looking at the Queens Medical Center inpatient stay for my patient. I get contact information. Maybe I'm trying to identify a great phone number contact or an address for my patient. Maybe I'm trying to identify who his primary care provider is, or sorry, this is a female, primary care provider is. I can see visit specific data like the admission date. I can see where they are, including the room. I can also see things like discharge date and time, and this will populate if the patient has been discharged. Obviously, this is a test patient. It's going to be limited. However, if you do come in and see one that's blank, oftentimes it indicates the patient's still in the hospital. You get the care team involved, so you can see the primary as well as who's taking care of the patient while they're in the hospital. Allergies reported by the patient, which also pulls over to the medication tab as well. You can see ICD-10 codes in this problem section if they share ICD-10s with us in their ADTs. So obviously with the reports, you can see ICD-10 codes there. But if they share ICD-10 codes with their ADTs, which Queens and Kona Community Hospital, and Kuakini, they currently do not share ICD-10 codes in their ADTs, but HPH, Castle, they do. So you can see those here. So visit specific, what they're in for. Emergency contact information and insurance plan information. This is very important and very friendly for our users, especially for our registration clerks who use our system. So if you have a patient with insurance for this particular visit, whatever they selected, you can see insurance plan 1, insurance plan 2, and insurance plan 3. Test patient, we don't have it, but you can see, and it can populate up to 3 health plans. So if the patient has a primary, a secondary, and a tertiary, it will pull up for the patient. So these are visit specific face sheets. So what you see on this one is going to be helpful, but it may be different than what you see on the second one. I like this because if you've got a patient coming in for a post, ER appointment or post inpatient appointment, and you keep calling them to schedule an appointment, but it's not working, you can come in here, go to face sheets and say, well, wait a minute, they were just in the hospital at Queens and the number is different than the one we have on file. You can have a better contact way to reach out to the patient. Maybe the number has changed since they've seen you. You do have the availability as well to print face sheets if need be. So great resource. And I think one that may be often overlooked, but it really has a lot of great information. I hope you found this tutorial helpful. My name's Clarissa. I am the Director of Provider Services. I am always here to conduct one-on-one trainings with our users. I love to tailor each training session to the patient's or the user's individual workflow. However, I know that's not always possible, which is why I decided to make this video. And so I really want to highlight these 3 tabs as well as the profile and face sheets. But as always, this is not an EHR. This is a data repository for viewing patient records, so therefore you cannot change the clinical data here. So while, the patient summary is really the only field where I say, please don't use this section, but the encounters tab, explore it. You may find it helpful in your individual workflow. This is where those ICD-10 codes from those ADTs live. So you can see those codes here. There are none because there's none for this test patient, but you can see those ICD-10 codes there as well as ADTs. That's what is the encounters tab. Create a care summary. This one is really cool because it pulls all of the clinical data from the results tab, from the encounters tab, and it creates a summarization of care. I only tell people to be careful with this one because we know the documents tab is a query and retrieve. So therefore, this is not going to pull that clinical data. So if you do create a care summary and you're looking at everything, just keep in mind that this is not comprehensive because we're not seeing the documentation from the documents tab be pulled into this section. Even if we've queried it, it's never going to be included in here. So explore this. Maybe you find this beneficial to your workflow. I always get calls because I tell people this isn't an EHR and they can't change data. But then they create a care summary and they see their name on it and they freak out and they call me. But I will reassure you that this is not a permanent document in this chart. Once I exit the patient's chart and go back in, it is completely gone. All that indicated was that you created it for you to view at that particular moment. So the documents tab data is not permanent data. It does have to be queried in once every single time you come into the patient chart. That's how we pull in the most up-to-date data. I've really enjoyed this training session. I hope you guys have too. Please reach out to us if you have any questions. Again, my name's Clarissa, the Director of Provider Services. You can reach out to us at helpdesk@hawaiihie.org. You can also reach out to us via our phone number, and then our website has contact information as well. Have a great day, everybody.